Just tilt it. Yeah, that's good. A little more. I think that's probably better.
There you go. Perfect.
Somewhere there. All right. Are we live?
Yeah.
Yeah. Hello, everybody. Welcome back to yet another episode of Fertility Fact or Fiction. Quite frankly, an awesome, fun time for us. I hope it's a fun time for you. I am Dr. Rahi Victory, a reproductive endocrinology and infertility specialist, double board certified in Canada and the US. And that in the background is my dear friend Tarek Ibrahim from Ibrahim Strategies Group, who does all things social media for us. So welcome to the show. Hopefully you guys have had a great week and had a wonderful long weekend. If you're in Canada, was it a long weekend in the States too?
No.
Just Canada?
I think they're next week. I don't know what they got.
No, Matt said he had a long weekend.
No, I'm almost certain it's next week for them. But you know what? I don't know.
I don't know either. Anyways,
I'm Canadian. Proud to be a Canadian.
I'm proud to be a Canadian too. So yeah, I hope you all enjoyed your long weekend. I spent my long weekend in the UK, collecting my beautiful bride who was there, trying to show my daughter which med school she should choose. And thank you for taking Jenna out there, Wendy. I love you dearly. It was a huge sacrifice. And thank you for going. And then a huge thank you to Lisa, our amazing nurse manager, business developer, all things conference, point of contact, SOP developer. She does lots of stuff for us. So she came as well, and we had a incredibly good time at the show. Thank you to all the amazing attendees. Hopefully most of you are asleep by now because it's 2 a.m. there, but or 1 a.m. there. But we had an amazing time. The show was so well organized, really well planned. We'll definitely be attending again next year. We had tons of people that actually showed up just to meet us, which was fabulous. And I was so honored and excited to meet so many friendly faces and people that have watched the show from far. And it's amazing for Tarek and I to know that this show has gone from 13 people, I think the first time we ever did it, to having a huge number of people watch the show worldwide. And so that's been amazing. The outreach and the outpouring of comments and messages and gratitude from people that have been able to achieve success because of what they've learned from the show has been just absolutely probably one of the highlights of my career. So thank you again to everyone at the show, the organizers, the attendees, the numerous incredible colleagues who came up to us and talked to us and said, we want to work with you. We love your message. We love how you do things. And so that was super exciting as well. We found partners to do monitoring with. We found potentially a partner to open a clinic with. We had, physicians, nurses, nutritionists, all sorts of great people. The people from Fertility Nutrition were there. I had done a podcast with them. They were great, super warm and friendly. Oana Garby, a good friend of ours, introduced me to some folks out there as well. So super exciting and a great time. And also, as a car fanatic, I must say London was amazing because I have never seen so many supercars before in my life. It was insane. So great time. And I do want to say that having traveled the world and seen a lot of different healthcare systems in a lot of different places, and you know that I am not shy about calling a spade. So I am not a huge fan of our medical system in North America in all aspects, because from the fertility standpoint, I think the medical systems are good. But from the fertility standpoint, I think a lot of it has been driven by money and by, pushing people to go into treatments that they don't necessarily need, treatments without a good explanation, or treatments that essentially are, maybe borderline, like you could do IUI or you could do IVF, but let's kind of nudge you maybe not so gently into doing the IVF. And so having traveled a lot, as not good as it is in North America, it's even worse outside of North America. We've met many people who just got horrible care. It was terrible, ridiculous things that we heard. People doing innumerable cycles of IVF with no changes, people doing IVF without even improving the egg quality or the sperm quality, people who dived right into IVF without even knowing why they were doing IVF. We had people being told to freeze the sperm when the sperm would never survive a freeze or a thaw. I mean, it was bonkers. Like, how can they do that to people? It should be not just immoral and it shouldn't just be unethical, that should be criminal. It really should. I mean, it's not fair to take people who are at their absolute most victimized, their absolute most susceptible, vulnerable, wanting to have a family and then take advantage of them. And people were like, well, I'm not paying for it because it's under the public health system. Yeah, but when it doesn't work, you then have to pay for it. So what happens then? Like, now you're still on the hook and you traumatize yourself or your partner going through it, and you got nothing to show for it, and now you lost your good chance because it was free. Now you got to start paying for it, and they're not even changing anything when you got to pay for it. It's the same thing all over again. And when it doesn't work, the same old adage, and I hate this, it's just try again. Nobody should ever be told just try again, ever. I mean, it's one thing if I tell you ahead of time, you're going to need 3 tries. You're going to need 4 tries. You're going to need 5 tries, whatever it is, 1 try, 2 tries, 10 tries. If I spell it out for you and you know what you're getting yourself into, my conscience is clear. I told you what you were going to need. You knew what you were going to need. We explained it all in detail. You were fine. But what is it going to be like when it's just basically someone saying, oh, do 1 cycle of IVF because we don't even know what's wrong with you and IVF is the best, which is nonsense. And then you do it and it doesn't work. And they go, well, just try again. I have one couple, which was the highlight of the whole show for me. They were told, and I love this, that endometriosis doesn't matter when you're doing IVF. So they did it and it didn't work. And what do you think the doctor said to them?
Try it again.
No, the doctor said, well, you have endometriosis and that's probably why it didn't
No
work.
way.
So which one is it? Like, it works and IVF doesn't matter, or endometriosis doesn't matter, or it doesn't work. And so it does matter. You can't have it both ways. You can't tell people, oh, yeah, it doesn't matter, just do IVF. And then when it doesn't work, you blame it on the one thing you said doesn't matter. Like, it's just ridiculously misleading people. So our care in North America is not perfect either. And I do want to make sure that everybody out there does the right thing. So I thought, having ranted for a minute there, I want to make sure I tell you guys what to do. Number 1, and people at the show ask me this, find a physician you feel you can trust. Listen to what they have to say, listen to how they say it. Make sure that they are presenting it in a way that makes it very clear that they have your best interests at heart. That is first and foremost and the most important thing you're going to do. Number 2, make absolutely sure, 100 million% sure, that they are figuring out what's wrong. Yes, we don't always have the ability to tell what's wrong, but it's pretty hard to actually exhaust testing. There's always more tests that can be done. And if you really go to the nth degree, you're doing the immune stuff, you're doing the microbiome, you're doing the genetics, you're doing your thrombophilia screen, whatever that is needed, you'll probably find an answer for what's wrong. Laparoscopy, sperm testing, DNA frag, whatever. There's always going to be something that you can correct. There's always going to be something you can improve. So make sure you actually know what's wrong with you before you jump into treatment. And then number 3, make sure you're presented A, with options, and B, with the knowledge to make an informed decision. You should never be pushed into a treatment simply because the doctor told you this is what's best for you. I've never once said that to a patient where I say, you can only do this unless they're in those super rare categories where there is no choice. Your tubes are blocked. You can't do anything but IVF. That's obvious. Okay, I get it. You have extremely severe male factor. You have the choice of doing IUI, but it's probably not going to work. You really need IVF. I'll still offer you the IUI, but I'll tell you, you have a less than 3% chance of success. But in the absence of something where there's an obvious problem where you absolutely are bound to doing one treatment only, there's absolutely no reason why you shouldn't have options. And so it's incredibly critical. It's super important that you find someone you trust, that you get the testing to know what's wrong, and then that you get the options that are available to you delivered to you in a manner which allows you to make an informed choice. If you're not getting that, you're getting absolutely crappy care. And I beg you, I implore you, don't get crappy care. I can plug that in over here, I think. Will it reach?
Maybe.
Oh, I don't know about that one. You got it on, no, it won't reach here. You got it on USB or something? Oh, don't worry, we're all good.
Yes.
So our light just went out. So yeah, I mean, I think all these things are critical to be aware of, and you got to make sure that you can get good care, because there are so many people in so many different places, Canada, the US, the UK, the rest of the world, who are being victimized. And this is medicine. No one should be victimized. That is horrible that I should even have to say that. So please don't be a victim. You're a patient. You deserve good care. Make sure you're getting good care. That's my rant because I didn't have an article.
It's great.
Was that a good rant?
I wish I was there to see it firsthand, to be honest.
It was crazy. Lisa and I were just like flabbergasted. She would just keep grabbing me from one couple and say, "You got to listen to this." And then I'd listen. And I was like, "Oh my God."
Dr. T would have lost his license.
Yeah, Dr. T would have lost his license. That's good. I like that. That's funny. Yeah.
My morning sickness finally let up, so I got to actually leave bed and go outside for the weekend.
Okay.
That's it. Just sharing with you.
Hey, very nice. Yeah.
Carly.
Yeah.
Our
resident.
Our resident here.
Yeah.
What's the chance of you inducing me tomorrow?
What's the chance of me inducing you tomorrow? Minimal, because I'm in the OR and I have to leave at 8 o'clock at night to catch a flight to TO. So I don't think you want me to induce you tomorrow, Car. Yeah.
Hello.
Hello.
What's the chance of a male being infertile?
50%. It's 40% female, 40% male, 20% both. So you've got a 50-50 chance. Although it's shifting slowly and becoming less female and more male as male sperm production starts to rapidly decline.
Really? That's a thing?
Yeah, there's one study, news article actually, that said that the estimate was that by 2050, the vast majority of men would be infertile.
That's when they go to the bear.
That's when they go to the bear.
That's when they go to the bear. That's it.
Yeah.
That's the sign.
Yeah. Yeah. Did you see that running with the bowling ball soccer on Lego? Yeah, I don't blame him. I'd go to the bear too.
My husband had a dream.
Okay.
That he was infertile.
Oh, okay.
Now, I'm worried. I have a daughter from another partner. And
that's easy. Just get them checked. Yeah.
That's the comment there.
Dr. Mia, can't do this anymore. WTF, stop leaving. Oh, that's hilarious.
Someone's asking, how do they submit a question? I think that's just general good.
Yeah, Sarah, just ask. Just post your question. We answer them as we can get them.
Facebook, Instagram, Twitter, even, to be honest.
Yeah, just don't do it everywhere at the same time.
Yeah, because then
that's annoying. It just takes up space. Yeah.
All right, let's go to the tube.
The tube.
Just had a horrible FET experience.
Oh.
They didn't come to me. What can I? Doctor was unable to get the catheter past my quote unquote tricky cervix.
Yeah.
And canceled the whole thing.
Oh, I had one of those today.
No way.
It took me probably 20 minutes to get through her cervix.
There's a tricky cervix.
Yeah, I mean, worst case scenario, you dilate under ultrasound guidance, and there's different kinds of catheters. So I had to use one that had a wire because the catheter kept going up into her C-section scar. Yeah, it can be challenging sometimes.
So it's a thing.
It's a thing. You can we've had a couple that were tough in my career.
So it shouldn't be so tough on this.
I probably had 2 or 3 that I actually couldn't do.
Really?
Yeah.
Oh wow.
Where I said refreeze the embryo. I was like, I can't get in. But today was getting close, but I made it. But it was tough.
That's where your Dr. V.
It was very, very tough. I was Dr. Lucky today.
So when you can't do it and you're freezing for another day, what changes in another day?
Haley's asking also, how do you submit questions? Just ask your questions, guys. If you're watching on TikTok, Instagram, Twitter, Facebook, whatever, just submit your questions, type in your question. What do you do if you bring them back another day?
Like what changes?
You dilate them first.
Oh, so now you know.
You stretch open the cervix so you
I
know
see.
you're going to get in. Yeah.
Gotcha.
Yeah.
I've never done it before, that's why.
Yeah.
I'm on Lupron plus Letro.
Okay.
Waiting on my lab report after 2 lits.
Okay.
If lad didn't go up,
Yeah.
can I continue with Vizan for 2 to 3 months until lad is fixed and do 2 months Lupron plus Letro for transfer again?
Totally reasonable. Absolutely. That's a very reasonable choice. And whoever said that, excellent suggestion.
Carly Steele is super angry. She gave angry face and face. A lot of anger here. How common is this? Was it incompetence because this is in reference to the tricky cervix.
Yeah. Was it incompetence?
Was it incompetence with a soft pass plus afterload, or would a transfer under anesthesia be better?
Under anesthesia isn't the problem. If they're injuring your cervix, your cervix will still start to contract, or your uterus will start to contract. So you got to make sure it's as not crampy as possible. It took me a long time to get through, and I had to use a wired catheter. It's like this rigid wire. I had to bend it, and then I used an ultrasound to make sure I was getting into the right place, and I finally was able to slip it in. It was not easy. Yeah, because it's like a fork in the road. So like this, for those who are watching, sorry, I went towards the camera instead of away. So the catheter naturally wanted to go up because the uterus was going down and the catheter just wanted to keep going up. So I curved it down, but then even with the curve down, it didn't want to go in. It was still hooking on the edge. So it took forever to just wiggle it into the right place. I finally got it, but
I'll be honest, I was one time taking a water pipe from one cabinet to the other, and there was already holes there.
Yeah.
So the hole was a little bit higher than where I was.
Yeah.
So I kept trying to fish it up.
Oh no, that's not gonna happen.
Impossible. So I just drilled another hole and said, "The hell with it." Obviously, you can't.
No,
drill holes.
I can't drill holes.
Probably not the best way to do it.
No. Although dilating is effectively drilling a hole.
Yeah. That's the way to do it.
Yeah.
Yeah. Hi, Dr. VNT. 38 years old, DOR, empty follicle syndrome. What are your thoughts on egg retrieval 37 hours after trigger shot instead of 36? What are the risks and benefits?
We did it for a while. About 10% of our patients released prematurely. I'm not a big believer in empty follicle syndrome. If you get triggered, you measure your hormone levels and they're flushing you and you're still not getting a follicle out, there is something wrong. It's very, very rare that we don't get a follicle out of somebody.
If I want to have a baby at 45,
yeah,
should I have certain testing done to check if I am healthy enough?
You should have basic testing done. Make sure your vitamins are up to date, your hemoglobin's normal, you're not diabetic, your blood pressure's okay, stuff like that. But if you're intent on trying naturally, you don't need anything beyond the basics. If you are intent on trying no matter what, you're going to need fertility assistance. And it is admittedly very difficult to get pregnant at 45. So you'd have to be factoring that into what you do.
How long is too long to stimulate the ovaries?
More than 12 days.
IVF cycle.
More than 12 days. That was one of the other things that drove me bonkers. Never even heard of this before. One of the couples we talked to, 21 days, I think she said, 19 or 21 days of stim. Yeah, I kid you not, like 3 weeks of stimulation. Crazy, like irrational. Irrational. And you're just making people pay for more drugs and more. Now, thank God in the UK, at least the drugs are cheap, but 1/5 the cost of here.
Wow.
Between 1/3 to 1/5. Yeah.
There's a plus. But the rest of it.
Not when you spend 3 times as long, you just add it up to the same thing.
They still get the same. They'll get even more.
Ridiculous, man. It was ridiculous. Yeah.
I had an HRT fails.
Yeah.
FET.
Yeah.
I got my period and it took a break.
Okay.
Now my period is 12 days late and I need it for a modified natural cycle. I'm normally like regular. What's going on?
No way to know. I mean, I'd have to get hormones tested. I'd have to see where your ultrasound is at, stuff like that. Get a preg test. You never know. Maybe your preg test was wrong.
Hi, Dr. V and Dr. T.
There you go. You love that. You love Dr. T.
I don't know.
You're getting
more. I don't know if I love reading it out loud, seeing it, or even just having that moment after I say it. I just let it sink in.
Yeah. Yeah.
Can a mini stem
Yeah.
with letrozole and Menopur produce better quality eggs?
No, that's been proven. There's no difference between mini stem and normal stem. However, there is some evidence showing that high dose stems is bad. So if you're going over like 375, you're up into the 450, 600, that kind of thing, that's a bad idea. But normal stem is okay. No difference between mini and normal.
The IVF lab
Yeah.
messed up and destroyed my PGTA biopsies. I'm 35, have 9 embryos, 4 day 5s and 5 day 6s. All of the embryos are 4AA.
Oh,
Should I retest or just try
no,
transferring?
no,
Lab will pay for transfers.
no. I wouldn't retest. I would just go ahead and do it. 50% of your embryos at 35 should be normal. So you're in good standing. You have great embryos. So maybe a few more will be normal, hopefully. If you really wanted to do something, do the AI. Like we use Life Whisperer AI, which can assess an image of the embryo and tell you if it's normal or not.
From an image. Don't touch.
Yeah, no touchy.
When do you use sirolimus to enhance egg quality in endometriosis? Endometriosis, yeah. What dosage duration is recommended before or after the egg retrieval? And where can I find references for the use of sirolimus in this context?
So we have a episode on rapamycin, which is sirolimus. So I don't know if you want to dig it up out of our YouTube. If you can put the link up, we'll pop up the link if Tara can find it. Look up rapamycin, RAPA, MYCIN. So that video talks about it. It was like 2-3 months ago, maybe longer than that. And then the references all over the place. We don't use it before the IVF because I don't believe in fresh transfers for endometriosis patients. And we're going to have a video for you. We're actually supposed to prep it tonight, but we spent too much time ordering our food. Sorry, guys. So we're going to have an endometriosis video, which will blow your minds. It's an awesome video, all the latest and greatest data, all the myths that people have been telling you and nonsense that they've been telling you, debunked. And so we'll have that video and we'll explain it all to you. The dose, 2 to 4 milligrams of sero or tacrolimus. We started 2 days before your embryo transfer and continue it for 14 days after. So total is 16 days. It's based on a previous study. And that's how we do it for us. Did you find no, you couldn't find it? Oh, no. Really? Rapamycin?
What was the video? Do you remember what it was called?
I think it was called rapamycin.
In the thumbnails, right?
Yeah. Do you want me to look for it on our?
There's so many. I'll try and get the link to put it up
Okay.
while we keep going.
Okay. Ask the question from Sarah because she was trying to.
Sarah, when coming in.
No. There was an earlier Sarah, one of the ones that asked, "You're going the wrong way, dude."
That's because you made me jump.
I know. The people that were asking how they ask a question.
How do you submit a question? I listened to a podcast where you said whatever you took to get pregnant, keep taking it through pregnancy.
Yes.
Does that include progesterone and other supplements?
Yeah, we continue progesterone until 36 weeks, and I don't stop supplements. So we continue till 36 weeks to reduce preterm labor.
Is intermittent fasting okay when actively trying to conceive?
Yes, we have a video on that actually.
Yeah.
Yeah, it's fine. There's no proven benefit to it, but there's indirect benefit. So we know it helps you lose weight. And if you're losing weight, we know that weight loss helps you get pregnant. So this whole thing about Ozempic babies is, in my opinion, a total bunch of nonsense. Ozempic isn't helping people get pregnant. Weight loss is helping people get pregnant. We've known that for ages. We didn't need Ozempic to tell us that. So, yeah.
I lost. My spot. Is it safe to do stims for egg retrieval while on Zepbound?
On what?
Zepbound. Zepbound.
No idea. I've never heard what Zepbound is.
If you have a miscarriage,
Yeah.
which is the best option for future fertility? Natural, passing, medication, DNC.
So probably the medication's the best balance of all factors, but it's horrible to do because it's crampy and bloody. And some of those patients will need a DNC. A DNC is generally very safe, but it varies from patient to patient. So you have to be very cautious if you're very thin or have damage to your uterus from previous treatments, or you've previously had Asherman's or something like that. Natural's fine, but it's very variable. The miscarriage rate for someone with a trying naturally is between 25 to 75%. So there's this like huge wide margin where anything can happen.
I don't know if this has to do with fertility,
Okay.
but my period skips 6 months sometimes. Is that normal?
No, and it's dangerous because that's a cancer risk if you have PCOS. So please make sure you get looked at.
Can we take Humira in week 1 and do lit in week 2? Will they interact this way? Can we take NAC-CoQ10, ALA, and especially treatment after lit also while on Humira?
Yes to all the supplements. I'd have to find out about the Humira while doing lit. I'm going to say probably not a great idea because overall Humira provides a substantial degree of cytokine inhibition, and you do need some cytokines to mount an antibody response. So off the physiological top of my head, I'm going to say no, don't do Humira and lit at the same time. But it would likely be okay if you let it dwindle for a bit first and then used it.
Hi, Dr. V. I'm a patient of yours.
Okay.
I was wondering
Yeah.
if you could refer me for Accessa or MRI guided ultrasound fibroid treatment.
Yeah.
I'm not comfortable with myomectomy.
Myomectomy. Access is not available in Canada to the best of my knowledge. We were going to be one of the trial sites. They stopped the whole thing at the last minute and bailed. I don't know why. I think our hospital was giving them some grief, but it never worked out. And then with regards to doing MRI guided high focused ultrasound, high frequency ultrasound, I think they do it in 1 or 2 places in Toronto. I don't believe it helps you. It's a maximum 50% shrinkage by volume. And if your fibroids are large, they're not going to be helpful. So I'm happy to refer you. I don't believe it's helpful, but by all means, I'll happily refer you to wherever you want.
Can IVIG replace lit if we decide to skip lit, just in case 2 lits are not enough?
No.
Trying to have a plan B.
No. And it's way more expensive. So no.
Dr. VNT. Second IUI failed.
Okay. Sorry.
My fiance's count was 3.5 million.
Oh, okay.
First cycle was Zymo wash, and nurse told us the count was low.
Okay.
3 million this time post Zymo wash, and we're told it was high. Please explain, how do we increase these counts?
Well, increasing is don't smoke, don't drink, don't use drugs, ejaculate every day or every 2 days, take the fertility vitamins, and avoid heat and embrace the cold. So no cell phones in your pocket, no laptop on your lap, no car seat heater, no jacuzzi, saunas, hot tubs, and then put frozen peas underneath the testicles and sit on them for 20 minutes a day. The high and the low, Zymo produces way less sperm count on the other end of it because it's a massive filter, right? Like you're not going to get anywhere near a normal count going through a Zymo filter because it retards all of the bad sperm, like 90% of them. So you get a much, much lower count on the other side of the Zymo. So don't panic about your post Zymo count. It's not nearly as relevant as it is from like a density gradient because you are getting very good quality sperm. Is 3 million enough? I don't think there's any research on that coming out of a Zymo. But we know that the counts can be lower and you can still achieve success.
And her last question was, and what is actually a realistic count of success?
Out of the Zymo, probably anything over 3 to 5 million is reasonable. In a normal circumstance, there's two big studies on this. One said 9 million total motile count. One said 14.
What do you like to see E2 and progesterone for endo patients after transfer? And how much monitoring should be done? Any other labs to check in early pregnancy?
So I don't follow E2 and progesterone between 130 to 150 nanograms per nanomoles per liter. While I was in the UK, and we'll probably talk to the team about this coming up, I did meet with someone that had a different progesterone protocol. They were claiming that it should be checked more often afterwards because they claim that they do see progesterone drops, and that's part of the issue. I haven't looked at the research yet, so don't call in and ask for this. I'm going to check into it first and see if that makes any sense. But if it does, we'll certainly embrace it. So it's something we would consider doing. But again, please don't call in asking for more progesterone tests. We don't even know if it's valuable yet. I have to look into it first.
What do you like to see E2 after progesterone?
We just did that.
Okay.
Yeah.
Hi, Dr. V.
Yeah. You got left out. Sorry,
Okay.
dude. Yeah.
Is it contraindicated
Oh.
to get your hair dyed while pregnant? I usually get highlights, but I don't bring bleach anywhere near my scalp.
Yeah. So someone just asked Sasha Hackman, my good friend, this, and she said, yes, it's safe. Yeah, it's not safe. So, and I love Sasha, but your head is one of the most absorbent parts of your body. Anything you put on there is going directly into your bloodstream. So would I be putting hair dye into my bloodstream when I'm pregnant? No, I wouldn't. I just think it's too risky. It's a whole lot of chemicals going to your baby.
What's better, a day 6 AB or a BA embryo?
That didn't give me enough information. A what BA embryo? A day 5 BA, a 5 BA, day 5 BA, a day 6 BA? Like, I don't know. You'd have to give me more info there.
Can you explain the evidence supporting ejaculation every other day to support improving sperm quality morphology? My RE and TCM doctors say it impacts sperm negatively.
Well, your RE doesn't know what they're talking about. There's lots of studies on this. Yeah, I mean, there's like dozens of studies on the frequency of ejaculation. Every day or every 2 days has been proven to be the best. You can look it up anywhere. I can pull up articles for you, but they're very much there. REs that make claims like that, I always wonder about because, like, show me the science. I mean, I get asked stuff about, the endo protocol all the time. While I was in the UK, people were like, well, my RE said this. And I pulled up the studies. They're like, why don't they know this? And I don't know. Did you get a cramp?
Yeah, it's okay.
Really?
We're dealing with it.
You're not getting a DVT on me, are you?
No, it's just I was in a, I ran and then I didn't bother undoing all this here. Yeah. What test should be ran after ectopic pregnancy is over?
Beta HCG every week until you make sure it goes below 5 and stays there for 3 weeks.
Can you develop issues that cause secondary infertility, like a low positive ANA that causes issues when it didn't before?
Yeah, of course. Yeah. Anything can happen after a pregnancy. It doesn't mean having a pregnancy doesn't mean you're not going to have secondary infertility. That's why we have secondary infertility, right? So you're not protected just because you got pregnant before. Things can develop. Endo can get worse. Fibroids can get worse. Cervical problems can get worse. Isthmoseals, all sorts of infections, all sorts of endometriotic problems. Yeah, there's loads of stuff that can happen.
Hey, Dr. VNT, can you review the prognosis of Asherman syndrome? Anything you do specifically for FET4 as patients?
So we clear the Asherman's first, and then I repeat the saline infusion scan to make sure it's cleared. And then we do a mock, which I never do, but in that case I would. And then if you're not getting a triple layer, we got a problem. Like those are cases where sometimes it doesn't work. You can't fix it. From the repair standpoint, it's best to use scissors if you can. And then from the standpoint of, prevention, high dose estrogen before, high dose estrogen after for at least a month on either side. So a month before and a month after. And then we would put in a balloon. Yeah, I have the last supply of balloons in Canada, I think.
Really?
Yeah, they had them available and I bought like everything they had. So, yeah.
Dr. V and Dr. T, what are your thoughts on luteal phase stimulations for IVF? When do you recommend them?
um, so I love luteal phase stimulations. I do believe the data that supports the idea that you get better quality eggs and embryos, although there's data suggesting it doesn't give you better. In our hands, it seems to. So yeah, I mean, I'm all for luteal phase. When? Anytime. I mean, there's no reason you have to stick to a follicular stim. Some patients have more eggs in the luteal. Go for the luteal. When do I recommend it? In general, when people have had failures with their follicular or they have low egg count. Either one of those are good reasons to go luteal.
Natural modified with LET. What's the longest you can go before transfer follicles growing slowly?
Indefinitely. So, I mean, there are studies that have shown that even up to a month are okay. I try not to go much past like day 18, 20, but you can. You got to go back to TikTok.
Yeah.
Are we getting slaughtered on?
Yeah. Okay, we can go to TikTok for a little bit.
You were on Sarah last.
No, Sarah was last?
Yeah, that was the last one you asked.
PCOS?
No.
No, then she did. Okay, hold on. St. Catharines. Yeah, here we go.
Okay.
Excited for St. Catharines. Can we monitor there and have you as our doctor travel to Windsor as needed?
Yep.
Thank you, doctor, for answering my question. I overall am healthy and have no clinical issues.
Excellent. Congratulations. We like healthy and no clinical issues.
What can be done during letrozole cycle to increase chances of pregnancy?
More vitamins, more sex, no smoking, no drinking, no drug use, lose weight, exercise regularly.
When coming in to see you for trying to have a baby with PCOS, what are the first steps?
Testing you and your partner, well, history, physical testing for you and your partner. And then for us, if it's just the PCO, we have 3 prongs. So number 1, medication. So that's letrozole, because that's been proven to be best. And then metformin if you need it. And then there's the lifestyle part and the supplements part. So supplements, NAC, coenzyme Q10, inositol, resveratrol, and ALA. And then the lifestyle part, diet and exercise. So a healthy diet, 6 meals a day, breakfast, snack, lunch, snack, dinner, snack. Exercise where you are building muscle. This is if you're not in the thin PCO category. If you're in the thin PCO category, you still need to have a healthy, balanced diet, but you don't need to calorie restrict. If you're in the not healthy, thin PCO, then you definitely need to address weight as an issue because it does decrease your chances and make responsiveness more difficult and then complications more difficult. You look very confused.
Because I want to make sure I didn't. There's a bunch that looked exactly the same.
Okay.
We had the same
Yeah.
icon. Hi, Dr. V. I just saw you today for my bleeding.
Yeah.
And an increase after the vaginal ultrasound.
Right.
I forgot to ask.
Yeah.
When will stop and are the babies in danger with this?
Well, it's not safe, and I don't have a crystal ball. I can't tell you when it's going to stop, but usually it stops as the sac expands, especially with 2 babies. As the sac expands, it presses everything up against the wall of the uterus, and there's less chance of bleeding. So pressure actually has a beneficial impact.
When do you come back, Carlos?
Friday. I leave Thursday morning and I come back Friday.
What is considered a frozen embryo transfer, and how long are the embryos frozen before a transfer?
They can be frozen 5 minutes before a transfer, but they wouldn't be. So a frozen embryo transfer is when the embryo was frozen and you have to thaw it in order to transfer it. It can be done a day before, 2 days before, months before, years before. I mean, it doesn't matter. So yeah, there's all sorts of opportunity. Generally speaking, it's done months before to either because you're doing a freeze-all, which is recommended now because it's a higher chance of pregnancy and safer, or because the patient has endo, because the success rates are higher and it's safer, or because you're trying to do something like PGT, or the patient had too high an estrogen level, they're at risk for OHSS. I mean, there's a bunch of different reasons, but it's when you've frozen the embryo and then you're thawing it to do a frozen embryo transfer.
4 weeks post-op, VSG, and missed my period. Is this normal?
VSG, vaginal surgery? I don't know what they're talking about. What's a VSG? I don't know what you mean by VSG, but you're not going to find it on Google.
They say it's a vertical sleeve gastrectomy surgery. Is
Oh,
that it?
I guess so.
Yeah, I think so.
Okay, cool. You did
Dr.
find
T
it.
to the
Dr. T, man. Yeah, I mean, that's a huge homeostatic physiologic shift in your vitamins, your intake, your physiology, everything. So yeah, missing your period would not be a shocker. But make sure you get a preg test, because if you're pregnant and you're in that phase, they're very likely going to tell you to terminate. So make sure you get a preg test. Follow up with your doctor.
What kind of medication jeopardizes the health of babies, doctor?
Oh, so there's lots, but the 20 main ones, there's probably more now, are ones that we call teratogens. So things like ACE inhibitors, lithium, Coumadin, stuff like that. We know those cause direct sort of malformations of the fetus that are well established. So there are many drugs like that that can cause very significant problems. So they must be avoided. They're absolutely contraindicated drugs.
Dr. VNT, best protocol for couples with limited bank sperm.
Oh, IVF. I mean, that's a no-brainer. If you don't have a lot of sperm left, you have to do IVF because it's your best chance by far. Best protocol, reasonable protocol that's going to yield the most number of high quality eggs. So everybody's different. So I don't think there's one protocol I could apply to everyone. That's the whole mode of VRC. We don't use one protocol for everybody. There isn't one protocol for everybody.
Would you advise someone to do acupuncture on the day of predicted ovulation for the release of the egg or the day after predicted ovulation for implantation?
I would recommend strongly that they speak to a traditional Chinese medicine specialist or naturopath, which I am neither, and that they answer you, because I don't know anything about that stuff. Here's my experience with acupuncture. I got one acupuncture done when my back was out several weeks ago. I was in agony. I could barely walk. March 20th, I injured it in New York. And a month later, I was still in agony, literally. So I got acupuncture done. It made me worse initially. And then about 3 weeks later, I did it again. It was far more aggressive the second time. I will not lie. It hurt like you know what. And I was better within about 5 minutes after that one was done. So, I mean, I am a believer because I've had some personal experience, but I know nothing about it. All I know is the first one I barely felt, and the second one, it hurt. Like, it really did not feel pleasant. Yeah.
Do you think fresh transfer is okay if you're using donor embryo,
Yeah.
reciprocal IVF partner egg?
Yeah. No problem at all. Because you're not getting a high estrogen level, so it's totally fine.
I don't believe, does the removal of endometrioma and excision surgery alone increase the chance of conceiving naturally?
Yes, that's been proven time and time and time again. That'll be in our endo video.
Hi, thank you both for everything. You're welcome. Suggestions for someone with Turner syndrome. Go ahead, that's for you.
Oh, wow. So there is a possibility of creating embryos. It is extremely difficult, and it must be attempted at a very young age, because you're not going to get very many eggs, and they do tend to go into menopause very, very early. So I would hurry. I would hurry, hurry, hurry. but that's all that you can do. There is not a lot that's available.
Right?
Yeah.
Hi, Dr. V plus T.
Plus T. All right.
33 years, female,
Okay.
AFC 45.
Woo. Wow.
Triggered day 10 of stim with 22 follicles.
Okay.
Greater than 15 millimeters because estrogen was 3,346 versus continuing to stim.
Okay.
Would you have pushed longer?
Yeah.
Absolutely.
Yeah. Yeah. I could tell from your expression, you were thinking that too. I mean, many of those eggs will not be mature, but I mean, I'd need to know how many of them were in the right range. So I don't want to say yeah. I would have waited to have seen how many were in the right range for maturity. And if there were a reasonable number in the right range for maturity, I would have triggered whenever they were reasonable. Someone asked how much a reversal costs. I don't know if you were talking about a vasectomy reversal or fallopian tube reversal. Unfortunately, it's a little more expensive now for fallopian tube reversals. So we're up at around $7,000 to $8,000, depending on how long it takes and how difficult it is. Vasectomy reversal, I think it's about 6, but don't quote me. I'm not a urologist and I don't do them.
Hello, Dr. Z and Dr. T. I recently found out that my AMH went from 9.8
Okay.
to 5.9
Oh.
picomoles in a few months.
Okay.
Why the drop?
I mean, there are conditions that can cause the ovary to drop, stress, infection, suppression, eating disorders. There's a variety of things that can contribute to it, but sometimes it's unexplained. And those are the ones we worry about the most because that's an impending menopause situation. So make sure you see someone and get it treated quickly. Also, there are studies showing very clearly that the lab machine and testing strategy used to measure AMH can vary widely and cause huge fluctuations in outcomes. So that could be it as well. What's a subscription leaderboard on TikTok? I got no idea.
You're on it though. You are on the
I
subscription
don't even
leaderboard.
I don't even know what that is.
Problem is they only come up
Yeah.
when we go live, and then if I touch it, I get nervous.
And Brittany really likes the live. Thank you, Brittany.
Brittany loves the live.
I love you
Brittany
too.
loves the live.
Yeah,
We love Brittany.
we love Britt.
We love likes. Give us a like, give us a share.
Britt, Tarek will look for your question. Ask whatever you want.
Ask whatever you want, whatever you want. Absolutely. You know who I haven't seen in a while? What's her name?
Oh yeah, our friend from Holland.
Our friend from Holland. That's right.
Habibi.
Yeah, Habibi. No Habibis in some time.
I know. Well, hopefully she's finally sleeping.
Yeah.
Aw, Britt said she loves us all too. That's very sweet. All right.
Special shout outs. My AMH level went from 3.7 to 6 in a 7-month period.
Okay.
Was taking supplements with high vitamin D and CoQ10. Didn't think a jump was like this was possible. Again,
it can be lab differences, stress, supplements, stuff like that can help. PRP can help. DHEA will help. Human growth hormone, testosterone. There are things that will increase it. Yeah.
Thoughts on a low-level fertility laser for retrieval for FET?
What? I don't even know what that means. Never heard of that before. I don't know what you're referring to. Be specific, maybe. We do laser the embryos before we do FETs if they haven't already been hatched, but generally we've already hatched them. So,
good afternoon, doctor.
Good evening.
I'm gonna mention that there was no S after doctor. Just put it out there.
This is really getting to your head, man.
Well, I feel
okay. At some point, you do need to realize. Do you know how hard I worked to get my medical degree? Like, but not 5 years of doing fact or fiction once a week. I'm talking 5 years of not sleeping.
I feel like I know. You know what the problem is?
Yeah.
I don't have any lab experience. That's the real problem.
You're not getting it with my patients.
Even if I see the problem, I don't know how to
Yeah.
fix it.
All those who would let T do their exam, show your hands, please.
That's a good question. That's a good question. Show of hands, everybody.
Yeah. God, I hope Nerve is not watching this show.
People will put their hands. People will put their hands up. I'm telling you. People are like, you know what? Because I always
Yeah.
make the rule.
Yeah. Thumbs up for a TARC exam. Thumbs down for no
Oh,
TARC
no
exam.
thumbs down. Thumbs up. Thumbs up and double thumbs up.
Oh, they're giving hearts, man.
See? See?
All right.
Brittany's laughing. Caitlin's laughing. Everybody's laughing. Yeah, see? Why not?
Because it's illegal. That's why.
Yeah. This isn't
We're not going there.
You know,
In a world where it's not illegal.
University students, they
Yeah.
go around and you know, am I that much worse than
They're in an accredited program.
I'm in the program of Dr. Victor?
Hey, my buddy, my current assistant got into med school.
Oh,
All three that he interviewed at. Yeah.
really?
Well, he got waitlisted at Queens. He got into U of T, and he got into Western.
Which one? The one that used to be here?
Nima.
Nima.
Yeah. Yeah.
I saw what's his face at Somerset the other day. The
What's his face?
yeah. He was here working with you for a little bit.
Keenan
Keenan.
at Somerset
Fuck.
yesterday.
Yeah.
Oh, I didn't know he was back. That's cool.
Yeah, I
Good
saw
for
him
him.
there. Yeah.
Oh, wow.
I guess they just landed.
Oh, must have. Yeah.
Yeah, see, there's a hype for Dr. T. There's a hype for Dr. T. I'm telling
Dude, there's a skeleton for Dr. T.
No, that skeleton is like, they're like so happy and laughing so hard, they almost died.
No,
Died of laughter.
I don't think that's the case.
That's how I interpreted that emoji. That emoji doesn't mean afraid of
Yeah,
death.
for those of you that are wondering, you will never be examined by TARC. Don't worry.
Don't worry, they won't hide.
Yeah,
I might walk around the office.
you might walk around the office
On the office.
on the other side of the
On the
closed
other
door.
side, yeah. They lock me out. Again, good afternoon, doctor. Where it all started.
Yeah.
I had a question.
Okay.
I had a tubal reversal in 2020,
Okay.
and I had 2 losses.
Oh,
And after that, I didn't get pregnant again. But I'm already 45 years old. It could be due to age.
Yeah.
I guess the question and the answer are all in one.
yeah. I mean, the losses and the inability to get pregnant can both be due to age. I would want to know your habits. I'd need to know your partner's habits. We need to know sperm quality, smoking, drinking, drug use. You'd need your tubes rechecked. I mean, there's a bunch of different stuff we do for a case like that. I can't tell you what you specifically should do because you're not my patient, but those are the kinds of things we would look at for that type of a case.
Of course.
That's Jenna, just nix her. What a goofball.
You're back.
Yeah.
Look great. Okay. Can you do a modified natural cycle after Lupron? You mentioned something about letrozole after it. Can you explain if you ovulate or not?
Well, Lupron alone is proven to be useless. So we don't advocate for just Lupron. So Lupron plus letrozole in 3 separate studies, because I just found another one tonight, has actually been shown to be beneficial. So if you're doing Lupron plus letrozole before your IVF or FET cycle, then you can gain a benefit. And if you just extend the letrozole a few extra days past where the Lupron should wear off, like 4 weeks for a 3.75 or 12 weeks for the 11.25 dose, just extend the letrozole a few more days and then stop it, your lining will start to grow. So that's all we do. Will a follicle grow? Sometimes. Will it release? Possibly. Can you trigger the release? Definitely. But you don't need that. You just need the lining to grow. And actually, I hate triggering follicle release. It's not natural, A, and B, it just screws everything up because you got to chase your progesterone levels. Yeah. Oh, Britt says, I am currently pregnant. I had a miscarriage 3 years ago. I am 33 and 3 months pregnant. Cool. Jenna said, what? What did my baby say? Yeah, rude. Rude is calling in the middle of the show, you monkey.
That's for sure. Do yeast infections affect FET?
Yes.
Would Fertility detect Pseudomonas
No, aeruginosa.
Yeah.
No, they don't look for it.
I had a 19-week loss from
Pseudomonas,
Pro
Corynebacterium.
Chromanionitis.
What?
What is this comment with these gigantic words? Chorioimmunitis.
Chorioamnionitis.
There you go. I guess I don't know everything.
Watching your lips form that was like
My
that
lips
was
couldn't do it.
painful, man.
Yeah, that's pro.
Yeah, so you won't pick up Pseudomonas from Fertility, but we could probably ask them to. In fact, I was going to ask them about that this weekend when we just had dinner together in England. They were with us. So, yeah, I can ask Pana and see if they can add that on. I'm sure they can. Chorioamnionitis.
I bet you anybody couldn't read that. I swear to God, that's a hell of a word.
Chorioamnionitis.
The problem with a flawed reading like that, when this clip goes to post-production and I hear myself read it, I will completely.
You just delete it out. That is so funny.
This will not exist tomorrow. That blunder is gone.
Well, I'm very sorry for your loss. That's horrible. We can ask, and if you want to reach out to me, it'll remind me. So DM me and remind me about Pseudomonas, and I'll ask Pana the next time I'm talking to him. I'm sure he can add it on. And I'd actually like to, because I recently had another patient that had that, so it makes sense.
Endo.
I'm with you.
Lab done in October 2023.
Okay.
Trying naturally. Positive ovulation test yesterday. Should I do aspirin, LDN, prednisone, Claritin, Pepsid, Benadryl now? If so, do I start in a few days?
Pepsid, Claritin, Benadryl have zero benefit. It's never been shown to be of value. Aspirin, yes. And then what was the other one? Progesterone. Progesterone, you have to start 2 days after you have a positive ovulation predictor kit.
LDN.
LDN, we've talked about it. I'm still working on the data. I don't know. I'm not convinced yet. It's a huge show.
Thanks for doing this every week, Dr. V and Dr. T.
Oh, and Dr. T. You are very welcome. Thank you for watching. We love doing this show.
I'm learning so much and appreciate you both. I appreciate you. Hi, Dr. VT. I have endo-adeno and did 3 months of Lupron.
Okay.
And had a miscarriage at 7 weeks.
Yeah. Lupron by itself is not enough.
More Lupron, or what should I do next?
Lupron and letrozole with an endo protocol. Supplements, tacrolimus, steroids, intralipids. Get your immunology checked. If you can treat the endo surgically, get the surgery. There's a lot that goes into it.
If CD138 biopsy finds plasma cells and doc says endometritis, are there any tips to low inflammation?
Yeah, get rid of the biopsy, get your Fertility or some other microbiome testing done. Target whatever the specific bacteria are and then treat them appropriately.
Do you have Americans that work with Canadian surrogates, and what is the process like?
We have dozens and dozens of Americans that work with Canadian surrogates. You reach out to us, we connect you with our process, we explain everything to you, we connect you with the agencies, they find you a surrogate, and away you go. We just had another baby for one of our couples that had already had one, actually, so they're now doing it twice. Yeah, all the time we do that.
What's the difference between Emma Alice by iGenomics versus Fertility?
Fertility doesn't make a test called the ERA test, which they know is fraudulent and still propose that it works. They give you more detail. They check for more bacteria. They check for viruses and yeast. And they give you relative quantification between the vagina and the uterus. So there's more detail, and I just don't trust iGenomics because the ERA test doesn't work, and they know it doesn't work, and they still claim that it works. So they're still selling something very expensive, even though they know it doesn't work. I have trust issues with that. So, yeah.
What is the highest dose of Gonal-F that you will try? Currently timing doing 300 Gonal-F and 200 per Govaris. Day 5 and only have follicles around 6 millimeters. It's too early. Can those doses be increased?
So 300 of Gonal-F and 200 of Pergoveris.
Mhm.
So you're actually on
300 going left, 200 pro.
Yeah, so you're actually on a massive dose of medications because that's the equivalent, roughly, of being on 430 of Gonal-F, and you're taking, oh no, sorry, you're on 500 of Gonal-F because the Pergoveris dose is just the dose of the Gonal-F that's in it, and then it's half Luveris. Yeah, don't be doing that. That's terrible for your egg quality. That's been proven. If you watch our show from last week, it showed that your total dose should be around 225. I realize your eggs are not growing at the pace you want, but pounding them with drugs just makes the eggs that are there to be terrible quality. It makes you really poor too. You know, that's really painful. I don't know why the hell it does that. It's so annoying.
We're here.
Well, I don't know. Yeah, it's stupid.
Right.
Yeah. Yeah.
Are there any health benefits to?
Someone asked me about an ostomy surgery. I've been part of many, many, many ostomy surgeries because I used to assist. They're fine as long as you've got a great surgeon, you'll do well. Yeah. I don't know about 6 weeks post-op. They usually work quite well.
Can you take Clomid and Letrozole together for PCOS?
Yes, you can. Yeah. I've never seen studies that show it's beneficial, but you can.
I haven't ovulated or had a period since I was 15. I'm 20. I was DX with PCOS at 16 via ultrasound.
Wow.
But I don't have insulin, weight, or testosterone issues. Doctor says IVF because weight, diet, and meds didn't work.
Yeah, call me or come see us. That you don't need IVF. Usually, if you're thin PCO, meds will work. You just need to find the right meds, and you need to be regular. So you must be on birth control when you are not on, an attempt to try and conceive, because it is not safe for you to go through life without regular periods. 9:02. What's the time limit for us tonight? Is it crazy?
I was so close.
Excuse me.
They're showing that pronunciation.
This lunatic is still looking for you guys to validate him as a physician.
Big word. I'm on you.
I thought you were talking about like Corynebacterium. I was like, why is he struggling with this?
I would not struggle with that. I could give that to a medical student in second year. He'd still not know how to do it. He'd be like, yo, what's a C word? That's what he would say.
Oh, that's priceless.
I'll give you one more.
Okay, one more.
You always put pressure on it.
Oh, Chels wants me to answer. Why would you have extreme ovulation pain following a section plus ectopic, struggling to conceive since? Endo would probably be my number one. How do you feel about starting red raspberry leaf tea at 32 weeks? Don't. There can be prostaglandins in it, and it can be harmful. So we definitely do not recommend that. Please don't. Please, please, please don't. Please, 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 please don't take any special weird teas.
Can baby aspirin cause any malformation in the fetus or affect the fetus in a negative way?
There have been studies of pregnant women with literally thousands upon thousands upon thousands of women with no detrimental effects on the baby. So could it? I'm sure it could. Is it being borne out in research studies? None that I am aware of. How long should you wait to TTC after a fallopian tube removal? Anytime you want. Chels, is it normal to have no follicles above 10 millimeters yet on day 10 for an IUI cycle? No, that's not normal. Done? Okay, we are going to call it a night. Thank you, guys. I am going to go home and try and reset my clock because I'm 5 hours behind. So why am I broken? Oh my God. Have a good night. And we wish you all the best. Next week, we're back, right?
I'm unaware of not being back.
Do we have a guest next week?
Guest.
We do. Who's coming on with us? We got to promote that. Who's coming on with us? It's not Cord Blood Bank. It's Donor Egg Bank.
Donor Egg Bank, yeah.
Right? Donor Egg Bank. Next week we have an exciting show with some representatives from Donor Egg Bank. They have frozen eggs, and they're going to tell us about their programs and why they're awesome. So we'll chat with you guys then, and we'll get the in and out. Do not take red raspberry leaf tea, please. Okay, lots of love, and have a great night. This is Dr. Rahi Victory, fertility specialist, and my good friend and comrade, in his own mind, Dr. Tarek Ibrahim.
And in the mind of others.
And in the mind of others, too. Have a good night, guys. We'll see you soon. Take care.
And in the mind of others.